Hi, this is Dr. Nels Sampatacos with Pro Sport, and this is an example of a revision rotator cuff repair that was performed for a 55-year-old female who originally had a ground level fall. This is her initial tear back in February, and it was torn. We repaired it at that time arthroscopically, and there were a few risk factors to her having a failure. She was smoking, she had a fall afterwards, and ultimately this led to a failure of this tissue. It not only ripped away, but it was attenuated. There was a fair amount of scarring, and so in this video I'm going to show the revision repair, which we can see here, and then following that repair we went ahead and applied a bioinductive implant over top of that, followed by an injection with platelet-rich plasma, or PRP, all of which is essentially designed to give her some additional biology to allow this tissue to heal. So here in the shoulder, we're looking at the extensive adhesions of this rotator cuff tear. It's very immobile, and so step one is releasing a lot of this to allow more mobility to that rotator cuff tissue. So there's a number of releases that we perform, and this just frees up a lot of that tissue so we can actually get it repaired and back down to where it's supposed to be. Here we can see a portion of the infraspinatus had actually healed well, but there were a number of anchors. These are anchors made of suture material that were used for the initial repair. These were nice because they require a very small hole to be drilled, only 2.6 millimeters. So they need to be removed, however, for this revision repair. So here I'm just cleaning up a lot of the adhesions and some of the degenerative cuff tissue that had been fairly attenuated. And I'm now mobilizing that tissue. I'm looking to see how much tension that tissue is going to be under, and it's quite a bit. So the first step here is we're going to place a suture that reduces some of that tension. This is called a margin convergence stitch. And we're just going to pull some of those edges of the tissue together, and that's going to allow for me to mobilize this just a little bit further, a little bit closer to where it needs to be on that bone there. And we can see that here. It's a little bit easier to get that over to where we want to repair it. And so now we have to deal with these osseous defects, these holes that are left from the prior anchors. And so we have to be a little strategic in terms of where we place these new anchors. They do have to be a larger diameter. So these anchors are 5.5 millimeters in diameter to fill up these prior defects. And so once we get those anchors in, we're just going to sew the sutures through the cuff tissue in a stepwise manner here, just to be able to get that tissue pulled back down to bone here. So we place the sutures for the first anchor here, and then we're going to proceed with a second anchor. This is another 5.5 millimeter anchor going into the bone there. We're going to pass the sutures in a similar way. And so basically we're using these devices here that pass a shuttle through that cuff tissue, and we use that to then send the suture from the anchor through that rotator cuff tissue. We do this multiple times so that we have sutures spread out throughout that rotator cuff tissue so that it's an even distribution of stress throughout that tissue. So after that I place a third anchor. Now this is one of these all suture anchors through a fairly small hole, and these are nice because these are suture tapes. They're very broad suture that grab hold of that tissue even better than the normal sutures. So we spread those sutures through that cuff tissue as well, and we're just finishing up the repair here, passing sutures all the way through that cuff tissue. And then so at this point we're going to start tying, and in this case I happen to be tying from the front to the back here, pulling that cuff tissue down, and we're cutting those sutures as we go. And unfortunately here, as I began to tie these tape sutures, the second suture caused that anchor to actually pull out of the bone. And unfortunately we see this sometimes in cases where the bone is of fairly poor quality. And so we had to cut that anchor out, and I had to replace it with a third 5.5 millimeter anchor here. So this is just one of these scenarios that we run into in cases of revision cuff tears where the bone quality just unfortunately can be a bit deficient. So here we're repassing sutures with this larger anchor, and then we continue the tying process here. And so this is me tying the back portion of that cuff, And these are arthroscopic knots called an SMC knot with 3 alternating half hitches. So it's a fairly robust knot that does a good job of holding that tissue firmly down to bone here. And so this is the completed revision repair that we see here. That cuff tissue is pulled down nicely to bone and looks very nice. So at this point, we're now going to insert this graft. This graft is of bovine origin. It's type 1 collagen, and it's going to rest on top of this revision repair and promote the healing process here by adding some additional biology. We're then going to hold it in place with these absorbable staples that we're going to insert all the way around the perimeter of that graft, and that's going to hold it very nicely to the underlying cuff repair. Now, all of this additional biology is absorbable, so that these staples will completely resorb as well as the graft by about 6 months. And so we're securing that all the way around here, just getting the corners and the sides, the front and the back here. And we can see how nice and smooth that collagen surface is here. And once it's secured around the sides here, we're going to use some more rigid absorbable staples that go into the bone here, these white staples here. We're going to place 3 of them on this lateral border of the graft here. And so that completes the graft fixation, which we can see very nicely here on top of the revision repair. And the last component of this is to inject PRP directly into that repair site underneath the graft here. And all of this, in addition to the patient having quit smoking, is going to help facilitate some additional healing. So that completes our case. Again, this is Dr. Nels Sampatacos with Pro Sport. Thanks very much for joining us. Bye.